Hello, my name is Dr. Christoph Götz. I am Chief Operating Officer and co-founder of ImageBiopsy Lab, and today I'm going to show you Lab Flamingo for automatic detection and classification of vertebral fractures. So the problem we address with this product is osteoporosis. It affects 500 million women and men globally, mostly disproportionately women age 50 or plus, which 1 in 3 women will actually suffer an osteoporotic fracture within their lifetime. And this has dramatic consequences. The most common osteoporotic fracture is a vertebral compression fracture of the spine. And it's clinically associated with an 8-fold increase of mortality. So really extremely important to act upon these fractures early. However, only 1 out of 3 of these vertebral fractures actually come to clinical attention. So how can that be? And what is the clinical consequence? So what happens is that an asymptomatic cohort, so elderly people with a vertebral compression fracture that is clinically not showing any signs of pain and so forth, they get into a CT scan for liver, lung, heart, so some kind of other referral, and they get their treatment for their primary clinical event. However, what happens is that a vertebral compression fracture is present, however missed. And this missed diagnosis of a fracture leads to subsequent fracture and hospitalization. Think of a hip fracture of the femur that really leads to a dramatic loss in life, dramatic increase in costs on treatment and follow-up care costs. So we want to address this missed opportunity for an early osteoporosis treatment, because once you have a femur fracture, then osteoporosis diagnosis is often very efficient and treatment thereof. However, we want to address this problem earlier, and I'm going to show you how. So I'm switching to a PACS viewer, and think you get referred for a lung cancer screening. So I'm now a radiologist screening the lung for a lung nodule that might be malignant. And so my job is really to find this one nodule, because it's about cancer, right? So look at for the lung nodule, and maybe this one is apparent, I don't know. So people are looking at the original referral, but what they miss is, for example, here you see it a little bit, there's a fracture. However, it's not very visible in these kind of views, and once people finish their referral, their original referral, like lung nodules, they often miss switching to the bone window and to a view that actually shows the spine in full detail, the sagittal view. So now it's very easy, right? Here's one, there's one, there's one. You don't need to, it's very obvious. But nonetheless, 85% of these fractures do not make it to the radiology report. And this means if they do not make it to the radiology report, exactly this chain of event happens. The vertebral fractures are present but missed, a subsequent fracture happens, and then the osteoporosis diagnosis and treatment starts delayed, and with this dramatic consequence in mortality and loss of quality of life. So what we do is we take any CT containing the spine, run in the background our early detection of vertebral compression fracture, and facilitate an early referral to the osteoporosis diagnosis and treatment pathway. How did we show how good we work? In a European study, we found 91% accuracy, meaning we detect a large amount of the patients in any kind of CT containing the spine. We're highlighting only the clinically relevant vertebral fractures of Janin grade 2 or 3 that are critically clinically associated with loss of life, mortality, loss of quality of life, and so forth. And what's most important is we find only the most critical fracture patients. We tuned the solution specifically for high specificity to not overburden the system with too many false positives. Since there's so few fractures detected in the state of the art, we only show you the most critical fracture patients. And we've shown this with large studies in Europe that looked at the state of the art and how much we actually improve the state of the art compared to the competition. So we have the exceptional ability to identify new patients with little overhead. And here in a tertiary system in Austria, we found that for a single CT device, so this is the data, a single CT device processing many scans a year, roughly 5,000 on average, there's approximately 280, 290 patients with a vertebral compression fracture in them on average, based on the prevalence. The state of the art, so the clinical baseline, detects around 44 of them only, meaning 244 go missed, never make it to the radiology report and do not come to clinical attention with all of its consequences. What we found in a study in Europe, testing the accuracy of the solution, is that we can identify 200 patients of those 244 that usually go amiss. Meaning we identify a large fraction, a relevant cohort, 460% more than the clinical state of the art. At the same time, here in yellow, we do not do too many overcalls. Only very few cases, the solution shows a case that actually does not contain a vertebral fracture. And how does this compare to the other competition from that also has AI for the detection of vertebral compression fractures? Well, they use a technology that looks only at a 2D slice of the image, which leads to many, many dramatic more false positives, which overburdens any kind of radiology systems. What we use is to look with a patented method at the whole vertebra at once in a 3D manner, and this gives the AI the ability to select only those patients that matter the most for your osteoporosis care pathway. So reach out today under flamingo@imagebiopsy.com. We want to talk to you. We want to run studies. We want to bring this into the clinic. The software has been CE MDR cleared by the reputable TÜV Süd in Germany, notified body. So this product has been tested extensively in 3 audits by regulatory bodies, by studies externally across Europe, and we are ready to improve your osteoporosis care pathway with this product. Get in touch today. Looking forward to talking to you.